You see these pearly whites? It takes a lot of work to maintain these babies. Between daily brushing and dental visits, it takes a team to manage your teeth. But today, I'd like to talk to you about something that's overlooked, and that is flossing. I'm sure your dentist has expressed to you the importance of flossing and it's redundant, but you know, it does help your overall oral health. Now, I'm going to discuss on how flossing can reduce and remove tartar and plaque buildup. I'm going to just talk to you about how flossing can also help prevent gum disease, gingivitis, and periodontal disease. I'm also going to talk about one of the little hidden aspects, positive aspects of flossing. And then also, I'm going to go into an area where we're going to talk about when it's okay not to floss. So first, this floss, is a little piece of floss, a little piece of thread. Now, most people grab this when they're eating and something gets lodged between their teeth and they need to get that little piece lodged out. That is one of the primary aspects of flossing, is to get food out of your teeth, which the benefit of that is that food can cause cavities. And what happens when you get a cavity, it's a hole in your tooth, you have to go to the dentist, you got to get a filling. So that's the first thing that's positive about flossing. Second, you know, go to bed, you lay in bed all night, wake up in the morning. Well, that period while you're sleeping, there's a bacteria that starts forming around your teeth. That bacteria is called tartar and plaque buildup. In the morning, you get up, eat breakfast, maybe brush, but brushing isn't enough. Flossing does help get all that bacteria and plaque off of your teeth. If you don't do that, there's a possibility your gums can become swollen or red. And that goes into my next topic, the symptoms of gingivitis and periodontal disease and gum disease. Now, when you don't floss, you could possibly get these diseases, which leads to bad breath, which won't go away. It leads to red and swollen gums, tender and bleeding gums, painful teeth, and possibly tooth loss. And no one wants tooth loss. Tooth loss leads to dentures and false teeth, and it'll be a difficult maintenance situation to maintain those teeth. Now, I've talked about all the negative aspects of flossing, but there is one small beneficial aspect to flossing. Oral-B has stated that there is a small anecdotal evidence that flossing can possibly lead to weight loss. Now, after I eat, and this is a personal experience, after I eat, if I floss and brush, I don't want to eat nothing else. I don't want to mess up this fresh mouth. So this is where Oral-B's evidence comes into play. It helps prevent snacking in between major meals. And with that, less snacking, less calories, so it can help in weight loss or weight control. Now, there are a lot of people who say, well, I have good teeth, I've never had to floss, and I don't feel I need to. Some of these people are right. With that, there are aspects or reasons where flossing, you can skip flossing. For instance, if you have sensitive gums, you would need to floss every other day or every couple days, or use a specialized floss. Second, if you have braces. If you have braces, you would have to use very sensitive floss or floss that is specialized, which can go between your teeth and the metal of braces. And last, maybe you're not very proficient in flossing, you cut your gums a little hard. Well, there's apparatuses now which give you the proper pressure for flossing. So you don't have to take the floss and beat yourself up and hurt your gums. So what I discussed today is the benefits of flossing. Talked about what happens if you don't floss, what could possibly happen if you don't floss. I've brought to you one aspect of outside of the oral care, oral hygiene, which flossing affects you. And I also talked about when you can't or when you shouldn't floss, or other devices that help you floss. So all in all, if you really want to value and eat the food you love, you're gonna make flossing your top priority.